Hello everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. So in our previous session, as we have discussed about what do we mean by admission, what are the different sources of admission, as well as what are the various roles and responsibilities that you as a nurse must perform during the admission procedure. In this session, we are going to discuss about discharge. So when do a patient get discharged? A patient only gets discharged after he or she has completed the treatment. So after the patient is admitted to the hospital and after the proper treatment has been given to the patient, when it is recognized that the patient is recovering from his illness, or if the patient does not require a constant supervision, then only we can start planning for their discharge. So in order to discharge the patient, it is necessary that you must receive a written order from the physician. Here it is the physician who will be deciding whether to discharge the patient or not, and if the physician has decided that the particular patient can be discharged, he will then write a written order on the patient's chart. So on seeing this, we can then get an idea that this patient have gotten an order to be discharged. Then it is also very important that, so when the doctor has decided that the patient can be discharged, he will then write an order on the patient's chart. This discharge is very important because this does not only involve the decision of the nurse or the doctor, but it involves the decision of the whole healthcare team. This can consist of the dietitians, the medical staff, the social staff, as well as all the nurses and the physicians who was in charge of this particular person. So discharge cannot be decided only by that particular physician. So moving on to the definition of discharge. So what is discharge? Discharge is nothing but it means the relieving of the patient from the hospital setting who have been admitted. So here, once a patient has been admitted and once the treatment has been provided to the patient, and if we realize that the patient does not need a constant supervision anymore, and if we have realized that he is regaining his normal health back, we will then discharge the patient from the hospital. So here there are 5 types of discharge. It can be the planned discharge, lama dama, transfer, abscon, as well as referral. So what do we mean by planned discharge? So planned discharge, from the name itself, we can understand that it is a planned one. Here we will be discharging the patient after he or she has completed the initial or the acute management in the hospital. And when you have realized that she does not need direct supervision. So here, when a person comes to the hospital, when the treatment has been provided and when he or she is regaining his health back, we will then plan for their discharge, right? Now moving on to the next one, that is lama or dama. Here, what do you mean by lama? Lama means leave against medical advice, and dama means discharge against medical advice. This lama and dama is a term which is used in the hospital institution when the patient have decided to leave the hospital against the advice of the doctor. So here, this lama or dama occurs when a patient wants to leave the hospital even without the advice of the doctor, or even without completing the treatment. So when a person have decided to leave against the doctor's advice, what we must do is we must first explain the patient and as well as the family members about the disease condition, about or what can be and what can be the possible effects that can also occur. And you must make sure that you tell them that neither the doctor nor the institution will be responsible for anything that can happen as soon as the patient leaves the hospital institution. So after everything has been explained to them, you must then take their signature on the consent letter to serve as a proof that if in case anything happens to the patient, you or the entire institution is not responsible for that. The next is transfer. So here, from the name itself, we can understand that transfer in discharge means that you will be transferring the patient either from one unit to the other or from one hospital to the other. And moving on to the next one, that is the referral. So referral here means you will be discharging the patient not because he or she has completed the treatment, but to refer the patient to the other hospital in order to carry out the further treatment. So for example, if a patient comes to the hospital and after all the diagnostic procedures have been performed, you have came to know that she is suffering from cancer. So in order to provide a proper treatment to the patient, you can then refer her to a specialized hospital, where she can be able to receive a good further treatment. So moving on to the last one, that is the abscon. So what do you mean by abscon? Abscon here means running away from the hospital. So this is a kind of a discharge whereby the patient himself will run away from the hospital without the completion of the treatment. This is a type where the patient will not be informing that he will be leaving the hospital, not to the nurse or not to the physician, but he will be running away from it. Now, in order for discharge to happen, you must plan for it, right? So here a nurse plays a major role in planning for the discharge of the patient. So as a nurse, we know, right, that continuity of care is very important. So in order to achieve this continuity of care, the nurse must use her critical thinking skills and apply the nursing process so that the discharge happens smoothly. As we know that, the discharge planning is a centralized, coordinated, as well as an interdisciplinary process. Why do we plan for a discharge? We plan for a discharge so that the patient will still be getting, the adequate care even after he or she is not in the hospital institution anymore. So here, by planning, before we discharging the patient, if we provide them about the necessary information that they should know about their particular disease condition and about their follow-up schedule, it will make things easier for them. We should also provide a safe and efficient return of all the clothings or the valuables which was provided to the hospital, and also to avoid any misunderstanding or miscommunication for the patient or the hospital in relation to the patient released from the hospital, to their medications or to their dues or referral. Discharge planning is also important because we can help the patient by making the safest arrangement possible at the time of their discharge. The next purpose is to assist the patient to manage successfully the change from the hospital setting to the home environment, and also to provide the continuity of care. So these are the various purposes of the discharge planning. Now moving on to the next one, that is the steps involved in the discharge procedure. So before we discharge the patient, it is very essential that evaluation of the patient must be done by a qualified personnel. So after the evaluation has been done, the next thing is there must be a discussion between the healthcare teams who was responsible for providing care for this particular patient, and also a discussion with the family members. After the patient has been evaluated and after the discussion is been done, then we must plan for the homecoming if the patient has been discharged with a plan one. And if the patient has been discharged because of, transferring of one patient from one hospital to the other, or referring the patient from one hospital to the other, then we must also prepare for the transfer of the patient. Now, before we discharge the patient, we should make sure to determine if the caregiver need any training or any other support in order to continue this providing of care in their home. If needed, we can also refer them to any home care agencies. And before discharging the patient, it is also very necessary that you explain all the procedures as well as their follow-up. So these are the steps which is involved in the discharge procedure. Now moving on to the next one, that is the role and responsibility of a nurse during the discharge. So here, in the preparation of discharge, what are the roles of a nurse? As a nurse, you should plan for the discharge from the very beginning. You should also plan for the rehabilitation and any follow-up needs. And you should also make sure that the caregivers must learn all the nursing procedures which needs to be done at home and also get its practice done. And the last one is you should make sure that you do the necessary arrangement for the transportation of the client. The next one here is planning. So here there is one approach that we should plan for care, and that is the method approach. So here M means medication. So as a nurse, before you discharge the client, you should make sure that the client as well as their family members So, as a nurse, before you discharge the patient, you must make sure that the patient, as well as the family members, must know the drug name, the dosage and the timing, the purpose of the drugs, the effects of the drugs, as well as the side effects that can occur because of this particular drug. Now, the next one, that is E. Here, E stands for the environment. So, before you discharge the client from the hospital settings, you should make sure that, which stands for environment. So before you discharge the patient from the hospital, you should make sure that the client will be able to, you should make sure that the patient will be able to achieve a good environment. You should make sure that there must be adequate physical, psychological, as well as emotional support from their family members. T. T here means treatment. So before you discharge the patient from the hospital, you must make sure that the patient, as well as the must know what are the treatments that need to be followed at home and what is the purpose of that treatment. You must also make sure that the caregivers have learned all the procedures which needs to be performed for the patient at home. Next is H, that is health teaching. So as a nurse, it is your responsibility that you must educate the patient as well as the family members about his or her disease condition and about how this disease condition is affecting their body function. You must also educate the importance of following the medications so that he or she will be able to attain a good health. Not only about the disease condition, but you must also try to educate them about the various factors or about the various methods that they can adopt to in their day-to-day life in order to promote their health. The next one here is O. O means outpatient services. So before you discharge the patient, you must make sure that the patient as well as the family members know when and where to book the appointments. They should know where and whom to call for medical help. You should also make sure that they take home all the discharge instructions which has been given to them so that it will be easy when they come back for the follow-up. And the last one here is the diet. So you must also educate them about the importance of having a good nutritious diet. You must also, educate them about the purpose of his or her personal diet and how this will be beneficial for them. So this is the approach which we can provide care for. That is the method approach. Now moving on to the next one, that is during the discharge. So what is your role and responsibility during the discharge? So before you discharge the patient, you must make sure that you see the doctor's written order. You must make sure that you have already educated them about the various methods that they should follow in their home settings. Handed over whatever belongings which was there in the hospital, as well as you should make sure that all the equipments as well as the hospital property has been returned back. As a nurse, you must also make sure that you should have informed all the other healthcare teams about this particular patient discharge, and you must also confirm that the bill has been paid and arrange for their transportation. So now here, if the patient has been discharged through Dharma, you should also make sure that you have receive their signature in the consent form. So these are the various things that you as a nurse should do during the discharge of the patient. Now moving on to the next one, that is after discharge. So what are the things you need to do after discharging the patient? So here after discharge, you as a nurse should make sure that you have all the documentations of the patient as well as care for the patient's room as well as the articles. So these are the various roles and responsibilities of a nurse during the discharge of a patient. Now moving on to the next one, that is the care of the unit. So here, after the patient has been discharged, before you admit another patient in that particular room, you must make sure that the room has been cleaned. You must make sure that all the doors and windows are open, and whatever articles that was used by the patient, you must take them to the utility room where these articles will be cleaned, sterilized, and if necessary disinfected by the chemicals. You must also make sure that all the articles are being rearranged and kept ready for the next use. All the unwanted things must be discarded, and all the used linens must be sent for laundry. You must also make sure that all the mattresses, the pillows, as well as the blankets which was used by the patient during the hospital stay must be kept in sunlight, and that the bed must be remade with new linens, new pillows, and new blankets before you admit any other patient. And if the room was used by a patient who was suffering from any communicable disease, You should make sure that the room as well as the articles must be fumigated. So these are the few things that you must keep in mind after the patient has been discharged from that particular unit and before you admit any other patient. So here we have come to the end of this topic, whereby in today's session we have discussed about discharge, the various types of discharge, the purpose of discharge, the steps which are involved in the discharge planning, the roles and responsibility of a nurse while preparing for discharge and during discharge as well as after the patient has been discharged. We've also discussed about the various steps that we need to do in order to take care of the particular unit after the patient had been discharged. So I hope you guys have understood the topic. Thank you.